Good day to each and everyone. We are Group 3 from Dentistry 3A2 and we are here to present about the cytomegalovirus. The contents of our report consists of the etiology, the structure of the organism, the pathophysiology, the clinical manifestation, and the histologic examination. Now for a short introduction. What is cytomegalovirus? It is a common virus and part of the herpes virus group that normally goes unnoticed in the human body but can be extremely harmful in immunosuppressed individuals. Etiology. The cytomegalovirus infection comes from the cytomegalovirus, or specifically the human cytomegalovirus, since there are different types of cytomegaloviruses. It is the common name of human herpes virus 5 from the viral subfamily Beta herpes virinae. This virus is obtained from human reservoir, spreading through sexual contact with other bodily fluids like saliva, blood, breast milk, tears, pee, and poo, or from transplanted organs. In other cases, congenital CMV, which is a common cytomegalovirus infection, can also be transmitted by pregnant mothers to their unborn child. CMV is unique in a way that it may periodically go dormant before becoming active again, and it can only be transmitted when it is in its active state. The cytomegalovirus transmits to immunologically naive recipients, and this happens when you contract CMV for the first time, if you have a previous infection which reactivates, or if you contract a different strain of CMV again. Once infected, the virus stays in your body permanently. However, most of the people who are carrying the cytomegalovirus are asymptomatic, making it easily transmittable and a lot more challenging to diagnose.
Structure of the organism. This icosahedral-shaped, encapsulated, double-stranded DNA B herpes virus known as cytomegalovirus has a diameter of 150 to 200 nanometers. And as we can see here in the picture, we have its components. First, for the exterior part, we have glycoprotein and envelope, and on the interior part, we have double-stranded DNA genome, nucleocapsid, and tegument. HCMV, or the human cytomegalovirus cell structure, is comprised of an icosahedral nucleocapsid which houses the double-stranded linear DNA core, and an exterior lipid bilayer envelope made up of different viral glycoproteins that participates in cell addition and penetration. Along with some cellular and viral RNA, the tegument contains two main types of proteins. One class of proteins plays a structural role in the construction and breakdown of the virion upon entry, and the other class alters the host cell's reaction to infection. Typically, the virion has a spherical composition with a size of about 200 to 300 nanometers. The HCMV genome is made up of two segments, a unique long segment and a unique short segment. It is a double-stranded DNA that is roughly 236 kilobase in size, making it the largest out of all human herpes viruses. And in comparison, it is more than 50% bigger than the herpes simplex virus 1, which causes cold sores, and is twice as big as the varicella zoster virus, which causes chickenpox. And these two are common human A herpes viruses. And although the HCMV capsid has a larger genome, it is still comparable to the herpes simplex virus 1, having an icosahedral organized nucleocapsid with triangulate number 16, made up of 12 pentons, 150 hexons, and 320 triplexes.
Now, for this slide, we're going to talk about the pathophysiology of the cytomegalovirus, or the CMV. So, in an initial infection or replication, the CMV infects all ages and is spread from an infected individual directly through body fluids, like for example, blood, saliva, urine, sperm, and also breast milk. So the cytomegalovirus is capable of infecting a wide variety of cell types, which includes epithelial cells or the oral epithelial cells. So, in an innate immunity host, the first stage of infection may be symptom-free or may manifest as a mononucleosis. So, the CMV initiates infection by penetrating the epithelial cells lining the salivary glands. However, it remains dormant and is excreted intermittently. So the human cytomegalovirus infects multiple cell types, including the macrophages, which are the first targets during human cytomegalovirus infections, and are thought to be crucial for viral persistence and dissemination. So as mentioned earlier, epithelial cells are also infected. The epithelial cells, when infected, produce more virus. And the T lymphocytes are also infected by the C lymphocytes are also infected by the cytomegalovirus. So when having a CMV infection, a O's eyes appearance will be noticed. These O's eyes appearance were able to conclude that high-risk patients had a higher risk of cytomegalovirus. So as you can see in the picture, it is very similar to the O's eyes. In the picture, it is very similar to the O's eyes, and it has O's eyes appearance because there is a large inclusion inside the nucleus, and this inclusion is called basophilic. And in addition to this, the small granular inclusion are also seen in the cytoplasm. Infected cells are shrinkly enlarged, often to a diameter of 40 micrometer, and show cellular and nuclear pleomorphism and are present in only one periglomerular renal tubule. So in situations of congenital or acquired cytomegalovirus infection, such inclusion bodies are often seen during autopsies or in biopsy specimens obtained from the kidneys, lungs, and several other organs.
Once the cell gets infected, it will respond immediately to stop the virus from causing damage to the body. This is true to the cell-mediated response. The cytotoxic T cell will primarily contain the virus. When the virus becomes latent, it will move into the lymphocytes, monocytes, and macrophages. HCMV establishes latency or it hides in the non-permissive myeloid cells. This is similar to the mechanisms of HIV, where it is inside the body waiting for its turn to be reactivated. As an overview, the primary infection occurs when an individual with no immunity, such as infants, against the virus becomes infected for the first time. Patients may be asymptomatic in this stage. Afterwards, the virus establishes latency from which it may be reactivated. This is the second type of infection. The third type of infection is called reinfection, when the contact with infectious individual results in superinfection of someone who has already been infected despite their possession of natural immunity. A healthy body can contain the said virus, but once a person becomes immunosuppressed or has a weakened immune system, the body cannot do its normal function or operation, making this an opportunity for the CMV to resurface. Cellular differentiation along with the inflammation-associated signaling are important events for reactivation of the myeloid lineage. When it's reactivated, virions reach the bloodstream and other body fluids, infecting other cells and tissues.
Clinical manifestation. The range of cytomegalovirus or CMV-related illnesses in humans is wide and mostly depends on the host. In immunocompetent hosts, CMV infection can result in a variety of illnesses. Actually, there are different types of cytomegalovirus infection, and these are the primary, which refers when a person is infected with CMV for the first time. Followed by the congenital. It is when the baby inherited CMV infection from the mother during birth. And lastly, reactivation. It is an infection that has been dormant and can reactivate once their immune system is weakened. And the perfect example for this one is the HIV. Now, talking about the adult cytomegalovirus infection in immunocompetent hosts. Majority of people are first exposed to CMV in their early years of life. Yes, early years of life. However, in healthy children and adults, who are infected with the virus may scarcely exhibit any cytomegalovirus infection symptoms. Actually, if you have primary CMV infection, it is actually just like a flu-like symptoms. It is mild. And the symptoms are fatigue, swollen glands, fever, sore throat, and muscle aches. And next is the congenital CMV symptoms. When the baby is born with CMV, then it might result to premature delivery, low birth weight or small size ang baby, and followed by bruise-like rashes, jaundice. Jaundice is having yellowish skin or eyes. And we also have swollen liver and spleen, and microcephaly or babies with small heads. And other examples are seizures, hearing loss, pneumonia, liver inflammation, or specifically hepatitis. So take note of that symptoms of primary CMV and congenital CMV.
Adult cytomegalovirus infection in the immunocompromised host. Immunocompromised patients with CMV infections experience significant morbidity and mortality, particularly in transplant recipients and those with HIV infection. Severe CMV illness can include pneumonitis, peritonitis, colitis, and encephalopathy. CMV can assault specific organs in persons with immune system deficiencies. The following are the main signs of these organ-specific infections. In the eye, there may be blindness or the presence of floaters in the eye, and it can also cause visual impairment. In the lungs, there can be pneumonia with impaired oxygen uptake, or what we call hypoxia. In the gastrointestinal tract, diarrhea may occur, or there may be swallowing difficulties or pain when swallowing, and ulcerations with bleeding. And for the brain, the patient can have coma, encephalitis with behavioral changes, and seizures. Symptoms of CMV with HIV. So as we all know, people with HIV are severely immunocompromised, so they experience worse symptoms compared to those who aren't. And some of these symptoms are as follows, and some of these have already been mentioned in the previous slides, but these are eyesight problems such as floaters and blurry vision, or even worse, it may lead to blindness. It can also cause diarrhea and belly pain. Next is painful swallowing because of ulcers in the mouth or in the esophagus. And we have confusion, lower back pain, weight loss, fatigue, and weakness in the legs particularly.
Histologic examination in cytomegalovirus includes hematoxylin and eosin or H&E staining. Imposing H&E staining helps to determine the types of cells and tissues, which then provides important information about the different characteristics of the cells in tissue samples. Eventually, it can diagnose a disease. Cells infected with CMV exhibit cytoplasmic and intranuclear viral inclusions. The CMV-infected cells are indicated on the image by yellow arrows. It has a thicker nuclear membrane, a greater size, and granular intracytoplasmic inclusions. The typical owl's eyes or basophilic intranuclear inclusion bodies are examples of CMV nucleoprotein cores that are actively replicating.
Immunohistochemistry, or IHC, is a method used to diagnose CMV infection or reactivation in tissues in a pathology laboratory. The use of IHC staining in CMV colitis proves its effectiveness in one of the cases that shows the overall positivity rate of CMV-IHC. So in the cases, the data reveal that the physician requests for immunosuppression, multiple blocks, and severe inflammation. It was strongly related to positive CMV-IHC detection rate, and these findings provide value in helping the pathologist to manage CMV-IHC testing more efficiently. So, the infected cells of CMV were also described to have an enlarged cytoplasm and nuclei, sharply demarcated nuclear membranes, and chromatin condensation with a surrounding halo.
Here is the list of our references. Presenting the Group 3 members: Adigue, Alverastine, Cabusas, Caumeran, Condrillon, Decatoria, Jemino, Maquilan, and Pedrita. This is Group 3, and thank you for listening.